Hello everyone, my name is Seth Stevens, and today we are doing our lesson over dental hygiene and oral care. Before we get started, I hope everyone is staying safe and healthy during this virus epidemic in our time. I know it can be very scary and, of course, boring because we can't do anything. But I'm sure in a couple more months, hopefully it'll clear up and it'll all be back to normal. That being said, we're going to continue with our lesson. First off, the oral hygiene definition includes all the processes for keeping a mouth clean and healthy. Good oral hygiene is necessary for prevention of dental caries, diseases, and bad breath. Major facts to know. Bacteria forms in 2 to 3 hours after brushing or flossing. Flossing can increase your lifespan to 6.4 years. This is because it can prevent diseases that can cause premature death, that means as a sort of a mouth cancer or something like that. Smoking and other tobacco is a leading cause to more than half of gum disease cases. I can really see this because I know a lot of people that chew tobacco, and I'm sure that cannot be any good for your mouth and teeth at all. Now we're going to get into the anatomy of a tooth. At the very top, we have the crown. It is the top part of the tooth and the only part you can normally see. Next, we have the gum line, and this is where the tooth and the gums connect. Without proper care, plaque and tartar will build up and cause gum disease. Third, we have the root, which is a part of the root that is in the bone. This holds the tooth in place. So whenever you're going and getting a tooth pulled at the dentist, this is what's really going to cause your somewhat pain and what's going to take the longest of getting the tooth out because it's being held down by the root. It is somewhat compared to a tree because the roots are what keep the tree alive and holds it in place. Next, we have the enamel. It is the outermost layer of the tooth. It is the hardest and the most mineralized tissue in the body. I thought that was pretty interesting. Next, we have dentin. It is the layer of the tooth under the enamel. And finally, we have the pulp. It's the soft tissue found in the center of all teeth where the nerve tissue and the blood vessels are. So this is the nerve in your tooth where you can tell if foods are hot or really cold. And I thought that was pretty interesting. Tooth decay. Pit and fissure caries. Begins on the biting surface of posterior teeth. Smooth and surface caries. Occurs when there is no pit, groove, or fault on the tooth. Collects in between teeth and along the gum line. And finally, we have nursing bottle caries. This is caused when a child sleeps with a bottle filled with anything except water. If you fill up a bottle with milk you may have bought at the store or any type of juice, it's not good for them. Even breast milk is said to not be the best. They need to have water at night. The picture you see at the bottom is an example of the first one because it's on the surface where you can actually see the tooth. That's how you know it's a pit and fissure carie. Now we have one of the diseases in the mouth. It's called gingivitis. Inflammation of the gingival tissue. So that's pretty much just how the gums around the teeth, as you see in the picture here, is a little puffy and it just doesn't look right. Next is bleeding gums. As you can see in the picture, the gums look very red, and a healthy gum would be like a pinkish color. And some factors of this are either hormonal and drug use, and like we said before, it's just like smoking cigarettes and chewing tobacco. Next disease we have is periodontitis. Infected gum recedes, plaque continues to increase, pockets become infected, bone loss starts, and I thought this statistic was kind of crazy because it affects 3 out of 4 people. As you can see, the little yellow stuff in between the teeth is the plaque from this individual not brushing his teeth properly. As you can see, his gums are very white, and they look almost infected of some sort. It's not very good. Probably pretty painful. Now we have how to prevent. So reduce sugar intake. That means um, eating sweet or sour candy, chocolate, just pretty much any junk food. Brushing twice a day. So that means in the morning and in the nighttime. They're both equally important and they both need to be done. Flossing. Now this is one of my personal problems and probably most others too, because flossing can be a hassle. And some people don't even know how to do it. And flossing is very vital along with brushing because it can get in the crevices and the spots where a toothbrush and its bristles, like you see in the picture, can't get to, which is very important. Use mouthwash. I personally love using mouthwash. I like how it tastes, and I like how it makes it's like a little burning sensation in your mouth when you spit it out. Honestly, it's a necessity to me. A healthy snack habit. So that means eating plenty of fruit and vegetables. And then the proper brushing method. And there's a proper flossing method too we're going to get into. And I'm going to tell you how to successfully do this task. Dental diet. So avoid foods that are high in sugar. Carbonated drinks are more acidic. This is a big problem for me because I love my Dr. Pepper and I drink at least 2 or 3 a day, which is not good at all. I probably need to quit. Foods like potato crisps tend to stick into the grooves and cause decay. Lots of chips can do this. I know in particular that I have on the top of my head is Cheeto Puffs. I feel like I'm always trying to get gunk out of my teeth that are stuck from the chips. Avoids excessive intake of fruit juices because they can be very acidic. Um, this is actually very true in I guess you could say Capri Suns and Hawaiian fruit punch and stuff like that. Very acidic stuff. Now we're going to get into the proper brushing method. The duration for brushing your teeth should be 2 minutes. I know there's tons of people that'll wake up in the morning, late for school, and they'll do a quick brush. I'll make sure they hit all their teeth and everything, and just spit it out and call it quits. And that's where people mess up because they're probably only brushing their teeth for maybe max a minute and 30 seconds, and that's not good. You have to take your time and really get at the teeth. I myself have an electric toothbrush, which helps me keep track of time because it probably has a certain time pool of at least 2 minutes for your teeth to get properly cleaned. Um, Next is tilt the brush at a 45-degree angle against the gum line and sweep the brush away from the gum line. Um, I may have this problem because I just hold my toothbrush however, and I brush my teeth about as good as possible. Um, but yes, you do need to have it at a 45-degree angle. Gently brush the outside, inside, and chewing surface of each tooth using short, back, and forth strokes. I do this, of course, and probably everybody else does too. It's not rocket science for that one. Gently brush your tongue to remove bacteria and freshen breath. This is a vital part for oral hygiene. People don't know this. Even if you brush your teeth and don't get your tongue, it's very possible your breath is still going to stink. And that's because of your tongue and how it breaks down the food for you to swallow. Um, Brushing your tongue is the best way to have better freshening breath. Now we're going to get into the proper floss method. So you want to use an arm's length, 18 inches of floss. Wrap around fingers mostly to one side. Next, floss each tooth forming a C shape with the floss each time. Number 3, a new area of floss should be introduced to each gingival pocket. You don't want to have that same nasty part of the floss getting into your grooves because that can just cause more infection or it doesn't properly clean it at all. You're pretty much defeating the purpose of it. Number 4, don't forget to floss behind last molar. This is pretty much just the two back corners of your mouth. which is one of the hardest places for your toothbrush to get to. That's why flossing is just as important as brushing. Flossing removes plaque from behind your teeth that brushing misses and helps prevent diseases, like I said. Replacement of tooth loss. Now we have the exact definition of this type of injury, and that is edentulosum, loss of one or more teeth. We have RPD, removal of partial denture, FPD, fixed partial denture, CD, complete denture, implant, prosthesis, which is the obturator. I have two little stories about this. My own father, when he was probably a teenager, and he was at the lake. He was skiing, and he fell, and apparently he was at a somewhat of a shallow part, and there was a rock sticking out of the water just a little bit, and he went face first into that rock and broke. I think it was the first tooth on the right side of this picture, and he had just broke off half of it, which was probably very painful. I'm sure it was. Of course, he got that fixed, and he has a half of a denture tooth in his mouth, which is really interesting. And for the second story, my grandfather has a full set of dentures. Back in the day, they didn't really worry about brushing their teeth. I mean, he was a kid, he probably never brushed his teeth, and he let it get awful, and he had to get dentures. And dentures are honestly pretty expensive, and they can be. So you want to take care of your teeth. Dental visits. All patients should regularly visit the dentist every 6 months. Patients should disclose HIV status, and these services should be provided: preventive, restorative, palliative, and rehabilitative. I personally go to the dentist every 6 months for a teeth clean. I know that it can be very expensive. I know when I go, we have dental insurance, so I think when I go to get my teeth cleaned, it's about $20. And then for some people without the dental insurance, it can be up to $100 and something. It's ridiculous. And some people don't ever go to the dentist at all, and that can be very hard, because just flossing and brushing can be hard. It can be hard just to keep your teeth clean and healthy. And in closing, remember to brush your teeth twice a day, morning and night. Don't forget your tongue, of course. Floss your teeth once a day. Rinse your mouth and use mouthwash, and incorporate healthy eating habits. Thank you so much. I hope you enjoyed this lesson, and have a great day.